Okay, guys, hello. So now we are on the third piece of the heart lecture, and we're going to talk about blood flow through the heart, and then we'll also talk about blood flow to the heart itself. So when you're going through this, I really suggest that you learn the structures in order, and that's the best way to make sure that you don't skip anything. So we'll start with the blood vessels, the veins that are going to bring blood to the right atrium. So there are two vena cava. You have the superior vena cava, and the superior vena cava is drain all the blood coming from above the heart, and that will drain into the right atrium. And then you have the inferior vena cava, and that drains everything from below the heart. And again, that empties into the right atrium. Remember that you always empty into an atria first because atria receive the blood. From there, the blood is going to go into the right ventricle. And the right ventricle is going to contract, and that's going to force the blood into the pulmonary trunk, which will become the pulmonary arteries. So what does pulmonary mean? Pulmonary means lungs. So the blood is going to go to the lungs. Okay, so the pulmonary arteries will take the blood to the lungs. While it's in the lung, it's going to drop off the carbon dioxide, pick up some oxygen. So now we have nice and oxygenated blood, and it's going to travel back to the heart by the pulmonary veins. Okay, so pulmonary veins towards the heart, arteries away, veins towards. Okay, so where do we go next? It has to be an atria. It's not going to be the right one, so it's going to be the left atrium. From the pulmonary veins to the left atrium, from the left atrium down into the left ventricle, always atria to ventricle. And then when the left ventricle contracts, that's going to be the systemic circuit. And the big artery that takes it to the body is going to be called the aorta. So the aorta will go up. Then from there, all of the other arteries will branch off of the aorta, take it to the body. And then how do we get back? The same way that we already started. Okay, so everything above the heart will come from the superior vena cava back to the right atrium. Everything from below the heart is going to go through the inferior vena cava back to the right atrium, and you just continue from there. Okay, so now I want to briefly talk a little bit about coloring on the diagrams. Generally, arteries are going to be red because they usually carry oxygenated blood, and oxygenated blood is a red color. And generally, veins are going to be colored blue because they are deoxygenated and they have more of a purpley type color. However, there's some exceptions that you need to understand. So for this pulmonary artery, it's still called an artery because you're taking blood away from the heart. However, at this stage, the blood has not yet picked up the oxygen, so it is still deoxygenated. So the pulmonary arteries are going to usually be shown as blue. Okay, so they're probably going to be the only arteries shown as blue. Whereas the pulmonary veins, even though they're veins, they have oxygenated blood in them because they just picked it up from the lungs. So usually they're depicted as red, but they're still veins because they're bringing blood back into the heart. Okay, so veins to the heart, arteries away from the heart. Okay, so again, you want to practice this multiple times. Make sure that you're very comfortable with which blood vessels connect to which. Let's practice real quick. So what I want you to do is go ahead and pause it and try to just write down really quickly how many blood vessels that you can name going through the heart. Okay, so first we have the aorta, then we have the pulmonary arteries, the pulmonary trunk to the pulmonary arteries, and then you would get back through the pulmonary veins. Then you have the superior vena cava going into the right atrium, inferior vena cava. So now what we need to do is, well, if you have all of these, which chambers are they going to connect to? And the secret to getting this correct is your process of elimination. And keep in mind that arteries receive blood, so they have to be connected to veins. And ventricles pump blood away, so they have to be connected to arteries. Okay, so if you keep that in mind, it'll be a lot easier to sort of figure out where each one goes. So the aorta takes the blood to the whole body. So it's an artery, so it's going to be connected to a ventricle. Which ventricle takes blood to the whole body? That would be the left ventricle. For the pulmonary means lungs. Okay, so it's an artery, so it's going to be connected to a ventricle. Which ventricle pumps blood to the lungs? That is going to be the right ventricle. And then if it's a vein, the pulmonary veins, it has to be connected to an atria. Okay, so veins connected to an atria. Which atria though? So if it's coming back into the heart, that's going to be the left atrium. Okay, now vena. Vena means veins. So the superior vena cava and the inferior vena cava, both of those are veins. And one bringing from the top of the head, one coming up from the bottom, below the heart. And they all empty into the right atrium. Okay, make sure you're very comfortable with that. Okay, now let's talk about some of the blood supply to the heart itself, because remember the heart is a tissue and especially metabolically active tissue because of that cardiac muscle. Okay, so it needs its own oxygen and nutrients, so you need to be able to bring blood to the heart itself. Okay, so let's look at this one right here. So here is the aorta. All of the arteries in the body branch off of the aorta except the pulmonary arteries. All of the other ones, though, are going to branch off of the aorta. Okay, so here's the left ventricle. There's the aorta there. Coming off of the aorta, we have the right coronary artery. Okay, that's going to go on to the right side and kind of travel between the atria, the right atrium, and the right ventricle. And then you have another branch on the other side, which is called the left coronary artery. And again, that's going to travel around between the boundary between the left atrium and the left ventricle. And then coming off of that, we have a couple of branches. Off of the left coronary artery, you're going to have a big branch that goes down and travels right down the front of the heart. That's going to be called the anterior interventricular artery. And what that does is it runs in a little groove right between the right ventricle and the left ventricle, so right between the two ventricles. That little groove is called the interventricular sulcus. Okay, so right down in the front, big red one, that's going to be the anterior interventricular artery. And then continuing, here's the left coronary artery again, continuing on the back side, you're going to have the circumflex artery. Circumflex as in circumference, as in wraps around. Okay. Now for the veins, right here, this picture is a little bit complicated, so let me explain what to you. So for this one here, if it's in orange, that means it's found on the front of the heart, the anterior side. If it's in green, it's found on the posterior side. Okay, so let's start with let's see, where should we start? Let's start with the posterior side. Okay, so the biggest vein draining the heart is the coronary sinus, and it's called this sinus because it's this large area that collects the blood. So remember, veins are draining the blood, so all of the blood is going to drain into the coronary sinus before it drains into the right atrium. So really there are 3 blood vessels connected to the right atrium. You have the superior vena cava, the inferior vena cava, and then also the coronary sinus. So the coronary sinus is going to be at the largest blue vein on the back side of the heart. Okay, so let's talk about ones that drain into it. If you're looking on the left side, right between, running also in that interventricular sulcus, so running right next to the anterior interventricular artery is going to be the great cardiac vein, The great cardiac vein is going to run right down the middle of the front of the heart. And then again, that drains into the coronary sinus. So the great means big. So you have the great cardiac vein. And then on the other side, on the back, you'll have the middle cardiac vein. It's just called that because it's a little bit smaller. And then running along the right side here, you have the small cardiac vein. Okay, so you have the middle cardiac vein on the back, the great cardiac vein in the very front. Along the right side there is going to be the small cardiac vein. And if you come up from the small cardiac vein, you have that anterior cardiac vein, which is this piece right in, like sort of a continuation from the small cardiac vein there. Okay, so again, all of those are going to empty into the coronary sinus before it goes into the heart. Okay, let's talk a little bit about blocked blood flow. So if you block arteries, that means that you're preventing oxygen and nutrients from reaching the tissues. And this is especially bad for cardiac muscle tissue because, like I said, it's very metabolically active. It's constantly contracting, needs a constant supply of energy, and therefore needs a constant supply of oxygen and nutrients to make that energy. And so once you block it, which is called a myocardial ischemia, that means a partial or complete blockage of the arteries, you can lead to a myocardial infarction, which is just a fancy way to say a heart attack. And what happens is because those cardiac muscle cells are not getting the oxygen and nutrients it need, they start to die. And that's how you get the myocardial or the heart attack, the myocardial infarction, the heart attack. Okay, so it just means that the heart muscle itself is not getting the blood supply that it needs. Okay, so let's look at this model right here. So if we look at this model, see these two very large, so one is red and one is blue. Okay, both of them are running down the interventricular sulcus, which is the groove between the ventricles, right in the very, very front of the heart. What is the name of the red one? The red one, if it's red, it's going to be an artery, except for the pulmonary arteries. So that would be the anterior interventricular artery. And if it is blue, that means it's going to be a vein, again, except for the pulmonary veins. And so that would be the great cardiac vein. Okay, those are the two big ones in the front. Okay, so last couple of slides, let's talk about fetal circulation. But really, I'm only talking about fetal circulation so I can talk a little bit more about some structures that we'll see in the grown-ups. Okay, so fetus. So fetus means inside, you know, in being held in the womb. And when the fetus is in the womb, the lungs aren't functioning. There's no, it's not breathing yet. Okay, so the lungs are not functioning, so there's no really reason to take the blood to the lungs to get oxygen and nutrients. Instead, the fetus is going to get their oxygen and nutrients from the placenta. So it still has a this heart is still beating, the blood is still moving, but there's no reason to take it to the lungs. So to bypass the lungs, there are two structures to sort of make two shortcuts really, instead, so it doesn't go to the lungs. The first is called the foramen ovale. So what that is, remember foramen means hole. So it's an oval hole that is located right between the right atrium and the left atrium. So because you don't need to do the pulmonary circuit, there's no reason not to just do a shortcut from the right atrium directly to the from the right atrium directly to the left atrium. That will then take you down to the left ventricle and you can just pump back to the body. Okay, so that's the first one, the foramen ovale, a hole between the two atria. And then the second one is a little chute, okay? It's called the ductus arteriosus. And what this is a little connected chute between the pulmonary trunk and the aorta. And so that if blood does go down into the right ventricle, instead of going to the pulmonary trunk all the way to the lungs, Some of it will bypass and take that little shortcut, the ductus arteriosus, which will take it to the aorta, and then it just goes again back with the body. Okay, so remember the focus of this is that you don't need the lungs because it's not functioning anyway. And so instead what they're going to do is go try to rejoin the systemic circuit. So I'm showing you these terms to explain these terms. Okay, so these are the terms that you need to know. Once you are grown up and fully functioning heart and lungs all working, though you no longer need those fetal structures. Okay, so they start to decompose and go away. Okay, so the first one is that foramen ovale. Remember, foramen means hole. The foramen ovale, which was the oval-shaped hole between the right atrium and the left atrium, that's going to close up. And that's going to create a depression, which is called a fossa. So the fossa ovalis is the depression, sort of like the scar tissue depression left once the foramen ovale closes up. So this is a structure you will need to know. It's going to be located, it's best seen in the right atrium. If you look at the right atrium and you look at the far wall, the one where the septum, the interarterial septum right between the two atria, that's where you're going to see the fossa ovalis. And then the second one, the ductus arteriosus, remember that was a little shunt that moved the blood directly from the pulmonary trunk to the aorta so that you don't need to go to the lungs. That also is going to close up, and instead what you have left is a little bit of scar tissue kind of connecting the two pieces. And so that's called the ligamentum arteriosum. So the ligamentum arteriosum is going to be this white structure right here that connects the pulmonary trunk to the aorta, to the aorta. Okay, so again, in an adult especially, usually by birth, these structures should have already, or not by birth, or soon after birth, these structures should already be closed up. So they should be just sort of non-functional leftover places. Okay, that's enough. Go ahead and take that mini quiz.